Hey you guys, thank you so much for tuning into my channel. My name is Ashley and today I am talking about mother-baby nursing. Now, I get a ton of questions in my inbox about people who want to be a mother-baby nurse, or they're curious about like what is mother-baby nursing. So being a mother-baby nurse, you take care of mom and baby 2 hours after the baby is born up until they are discharged. So on the mother baby unit, you'll be doing a ton of education with the mom because you want to prepare them for going home with this brand new baby. So on a typical 12-hour shift for me, I usually come in, I get report from the night shift nurse on my patients. I go check on my patients, doing vital signs and assessments. And in mother baby, you have couplets. Couplets are your mom and her newborn baby. So we do couplet care. So also in the morning time, I like to pass out pain medication because sometimes the patients have been sleeping all night and you know they usually wake up and they want their pain medicine. So I usually have pain medicine ready to be passed around. And also on the mother baby unit, you'll also be passing around a lot of Colace, which is a stool softener. So you pass out a lot of stool softeners, ibuprofen. So after I do my assessment and vital signs on mom and baby, I usually like to sit down and chart everything. So I'll chart a head to toe assessment on the babies, and then with the moms we really focus on heart and lung sounds, their bowel sounds, their pulses, fundus, which is another name for the uterus. So we focus on fundal height. We focus on vaginal bleeding. And then with my babies, we'll do like a head to toe assessment on them. You know, feeling their fingernails in the front and back of their head, you know, feeling their pulses, checking their reflexes, looking at their color, their tone, and making sure their spine is straight and everything like that. So once I get finished charting, I usually get back up and go check on my patients and see how everybody is doing. Now while this is going on, you know, you still might have patients who call out on the call light for something, or you know, you might have a mom that needs help with breastfeeding or something like that. So after I get done rounding on my patients and checking on them, I usually might start off a conversation with the other nurses, you know, just talking. And this is on a typical day. Most of my days aren't typical. So specifically for newborn care. So when I am taking care of babies, some of the things I have to do for them. So on admission, babies, they usually give vitamin K shots and erythromycin ointment in their eyes unless their parents refuse. On admission, we do their weight. We measure their head, abdomen, and chest circumference. We do an assessment. We get vital signs on them. We get a blood sugar on them. And we ask mom, you know, are you breastfeeding or bottle feeding? Once the baby gets to my floor, we do another assessment on the baby, another set of vital signs, and then we give the baby a bath. So after I bathe the baby, usually this is the time that I'll give the baby the hepatitis B shot if the parents want the baby to give the hepatitis B shot. Once I bathe the baby, you know, you take the baby back to room with mom and let them bond. Then at like 24 hours, we have to do newborn screening on the baby. And newborn screening, it's just a way to check for different diseases that are in newborns. We check their bilirubin levels, which if a baby has a high bilirubin level, then they could possibly have jaundice. And usually if babies have high bilirubin levels, then we do have to put them under Billy lights, which are like these blue like UV lights, and they have to wear an eye mask and a diaper at all times. We also check them for congenital heart disease. We also do a weight on them just to make sure their feeding is going well. As far as caring for the moms, a C-section or a vag really determines how I care for them. I care for them the same way, but with C-sections you look for specific things, and then with vaginals you look for specific things. So with vaginal deliveries, these patients, they pretty much can do for themselves. So with my vaginal deliveries, with my assessments, I'm focusing on heart and lung sounds, bowel sounds, are they passing gas, checking them for hemorrhoids, checking their vaginal bleeding, make sure they're not bleeding too much, checking their fundal height, and fundus is just another name for uterus. I'm checking the pulses in their feet, checking for swelling. You know, I always encourage my patients, you know, make sure you're going to the bathroom at least every 2 to 3 hours. And then as far as C-sections, now for the most part, they need a lot of help. So when you first get a C-section up, most of the time they're going to be on bed rest for like 12 to 24 hours because they've just had a major surgery. So with C-sections, they usually have a Foley catheter in, and you as the nurse has to come in and you have to change their pad and everything because they can't get up. Now with the C-section assessment, you do pretty much the same thing, but you also want to check their incision site. You know, make sure that their incision is intact, it doesn't look infected. You know, if they have like a dressing covering their incision. And then of course, after you take the Foley out of your C-section patient, then they're able to get up, and you always want to be with your C-section patient the first time they get up, just in case they're feeling dizzy, lightheaded, or anything, because you have to remember that this is their first time getting up in probably like 24 hours. Some of the complications that I've seen in moms, you know, hemorrhaging. Hemorrhaging is where a mom is having too much vaginal bleeding, like she's soaking her pad every hour, or she's passing blood clots that are like the size of an egg or golf ball, or some of them have infections. And then you also have to watch for blood pressure in the moms, because I'm watching for those complications. And then complications in babies. As you know, every baby that's born isn't a well baby, and with babies you have to really be cognizant of them, because they can't talk to you, they can't tell you if something is wrong with them. So you really have to have good assessment skills when you're assessing your babies, whether that's looking at their color. You know, if your baby's tachycardic, has a high heart rate, if your baby's tachypnic, has a high respiratory rate, if your baby has a fever, if your baby's not eating well, it's a poor feeder. And we also have babies who are on antibiotics. Now, on my unit, we don't start IVs, but we do give baby antibiotics. So if a baby does need an IV started, we send that baby down to NICU, which is our neonatal ICU, and they'll start the IV, and then we will hang the baby's antibiotics. I love being a mother baby nurse. This was my first job straight out of nursing school. I did not want to do the traditional med surg. I knew I wanted to be a mother baby nurse. I was exposed to it during clinicals, because you know, I always thought I wanted to be labor and delivery, but once I saw that, oh, there's a side where mother baby, I was like, okay, this fits my personality. And I was able to have my senior preceptorship on the mother baby unit, and I think that that really helped me in getting my first job out of school as a mother baby nurse. And being a mother baby nurse, you have to educate your patients a lot. So we educate patients on safe sleeping. We're helping moms with breastfeeding. You know, how often do you need to feed your baby? You know, make sure you're burping your baby. Educating moms on, you know, if your baby's choking, turning blue or purple. Educating mom on how much bleeding is too much. And, you know, if mom is passing blood clots, they're like the size of an egg or golf ball, you know, just encouraging your patients to ask you any type of questions that they have, because you want your moms to feel comfortable going home with these precious babies. So I did post on my Instagram that I was posting a video all about being a mother baby nurse, and I do have a few questions to answer. So the first question is from, hopefully I'm pronouncing your name right, Leia_Tayama. She asked, did you start off as a grad nurse residency program? If so, did it make the transition from nursing school to a real bedside nurse easier? Also, any tips on strengthening your assessment skills, like being able to spot signs of complication in mom and baby? And 3, what made you choose postpartum care? I am taking maternity clinical for the summer and I love it, but can't decide if I like L&D or postpartum care. So with the first question, I did start off in a nurse residency program for mother baby at my hospital, and this program lasts for like 2 years. So I had orientation for like 6 months. So I was with a preceptor for 6 months, and then I was on my own taking care of patients. But I literally wasn't on my own. Of course, I made sure to like work the shifts that my preceptor was working. I needed to ask a question. I was gonna ask her because, you know, I've been with her for 6 months. But all the nurses on my unit, you know, if I've asked them questions, like, they pretty much been open to answer them. And residency program, I think, is a great way to transition into bedside nursing, because you learn everything you need to know about being a mother baby nurse basically through your training with your preceptor. So yes, I do still use, you know, the knowledge that I learned in my mother baby class back in nursing school, but for the most part, being hands-on and learning from my preceptor and other nurses is the way that I learned how to take care of my moms and babies. So the second question, any tips on strengthening your assessment skills? I think as far as strengthening your assessment skills, you just have to, it just comes with time. And also, I know one thing, the nurses on my unit, like when something wasn't going right with a patient, like you had a baby a baby going bad, or like a baby having complications, or a mom having complications, you know, they will always pull me in and just show me, you know, like, this isn't right or something like that. So I think assessment skills just come with time and just experiencing different things as a mother baby nurse. So just going through different experiences will help strengthen your assessment skills, because you have to know, like, you're a new grad nurse, you're not gonna know everything. And just make sure you're always asking questions. Like, if something's not looking right on your mom or baby, don't be afraid to ask another nurse, you know, her opinion of what's going on with your mom and baby. And the third question is, what made me choose postpartum care? Just seeing it when I was in clinicals during nursing school really made me choose postpartum over labor and delivery. I feel like if you want to do labor and delivery nurse, you have to be ready for anything, like, because when those patients come through those doors, you never know what to expect. You might have a mom that's bleeding and she has to go back for a stat C-section, or you just might have, and it's just crazy. Like, labor and delivery is like the women's health emergency room. So the next question is from Kima. Hey Kima. So she says, I have 2 questions. I hear a lot of people say that you lose your skills while working in the OB specialties. Do you agree? Was it hard to get a position in postpartum, and do you know if it's hard to get one in labor and delivery? I'll be graduating in December, and I know I want to do labor and delivery. So as far as losing your skills when you switch over to OB specialties, I've only been doing mother baby nursing my entire nursing career, so I really can't answer that. But we do have some nurses on our floor who came from med-surg floors, and what they'll do sometimes so that they don't lose their skills is that on days when our unit, we don't have enough patients, so our census is low, they might float to their old med-surg floors and help out down there. And that's another way to keep their skills. And the second question, was it hard to get a position in postpartum? And do you know if it's hard to get one in labor and delivery? It was hard for me to get a job in postpartum. It wasn't hard to get a job in postpartum, but finding a postpartum job might be hard, because when people are in OB specialties, they usually don't leave. So with if you're trying to find a job in labor and delivery or postpartum, I recommend trying to get your senior practicum or senior preceptorship on like a postpartum or labor and delivery floor, because that opens up doors right there for you to get hired once you graduate from nursing school. Or you can just search around on the internet for the hospitals in your area, see if they have new grad nurse residency programs in postpartum and labor and delivery. And sometimes if you're not able to find a job in the city that you live in, you might have to branch out and look into other cities, because I knew if I didn't get a job in postpartum in my current city that I was going to end up applying for a postpartum position in Birmingham, Alabama, because that's how bad I really want to be a mother-baby nurse. And as far as applying, if you're graduating in December, I would start looking online now, even though it's June. Well, I might wait a little bit, but I know people were getting hired. I graduated nursing school in May. People were getting hired in like January and February for new grad nurse jobs. So I think you should start looking early, like maybe August, September. I think October should be your latest that you start looking. You just have to figure out which specialty better fits your personality. Next question is from Lita Bobita. Hopefully I'm saying that right. She asks, how do you apply for mother baby postpartum nursing job? How was the interview? Did they train you? So yes, they did train me for mother baby nursing. I got 6 months of training with my preceptor. The interview went well. I had to interview with 3 different people. So the first person was in the HR department. The second person I interviewed with was the person who was in charge of, who was overseeing the residency program. And then the third person I interviewed with was a nurse manager of the mother baby floor. And I knew about an hour or so after my interview that I was hired for the job. And I'll actually link my interview tips video up above, and in this video I go in depth with my interview and let you know the process. I give you tips on how to land your dream job out of nursing school. And as far as applying for mother baby jobs, you just have to, you know, look at different hospitals in your area and figure out which ones are going to hire new grads as mother baby nurses. This last question is from Kyria_H. Hopefully I pronounced your name right. She asks, what is the minimum hourly pay you'll accept as a new nurse working in your specialty? By the way, I love you, Ashley. Oh, I love you too. Now, as far as the minimum pay I was accepting as a new grad, I pretty much took what they gave me, because you have to understand, you know, you're a new grad, you have no experience, so they're going to start you out at a base rate. And I think in my hospital you don't get paid by your specialty. I think they do. You get paid by your experience. So with each year, like, we get a raise. Earlier when I was talking about couplet care, now with couplet care you are taking care of 2 patients, mom and baby, but on a good day I might have 2 to 3 couplets, so that's like 4 to 6 patients. But on a bad day when we're short staffed, I might have 5 couplets, so it's 10 patients. So I just wanted to clarify about couplet care and just make sure that y'all didn't think I was only taking care of 2 patients, you know, each 12-hour shift. But I hope you guys enjoyed this video. I plan to continue the Nurse Betty series and bring other nurses on my channel who are in different specialties. So if you are in the Memphis area and you're in a specialty other than mother baby and you would love to be on my channel and don't mind being interviewed and asked all about your specialty, then please send me an email at prettynurseashley@gmail.com. and I also have some nurse friends here who I would definitely want to get on my channel. So if you guys are watching, y'all need to get ready, honey, because I'm gonna be texting y'all about coming on my channel, and don't be acting shy. But hopefully I answered all you guys' questions about mother baby nursing. If I missed something, please leave me a comment down below. I didn't want this video to be extremely long, but there's a lot that goes into mother baby nursing, so hopefully I covered the high points. But thank you so much for watching.